If you're tired of wearing glasses or contacts, maybe you can restore your eyes with LASIK surgery. Are you a candidate? Well, welcome, Dr. Shamik Bafna. Did I pronounce it correctly?
Nice to meet you, Robin.
Clear Choice Laser. Very nice to meet you. Isn't that funny that her last name is I, and I'm coming over to you to talk to about eyes? I think it is fantastic. Okay, we're talking about LASIK because this is something you'll be talking about at the men's show this weekend. And we hear a lot about LASIK. So I guess we have to ask, first of all, what is it?
LASIK is laser vision correction, and essentially what you do is you have patients that have glasses or contact lenses, and by using a very quick 15-minute procedure, we can have a lifetime of good vision.
All right, so at the men's show, you're going to be doing screenings to see who is a good candidate for?
We will be doing free screenings out there, and actually if you come out there, you can have about $1,000 off your procedure.
Really?
So there's a lot of good things.
Okay, now, can everybody who has vision problems have LASIK?
We actually need to screen for good candidates. Not everyone is a good candidate.
Okay, who is a good candidate?
Well, we have to take several measurements, and we have to see how high your prescription is. We look at the thickness of your corneas, your pupil size, various different factors. But I would say...
Do you put people under when you do this?
Oh, not at all.
No?
I mean, you just go ahead and take some very simple measurements.
And how do you go about doing that?
You actually sit in front of a machine, and the machine
does it. So you're not
seconds.
Actually using like a miniature tape measure to go into the eye.
Nothing quite that sophisticated.
Yeah. You're horrified that I even said that. Okay, so is it primarily, though, for people who cannot see far away?
Well, actually, it's for people that have difficulty up close, far away. These days, we have many different types of technologies available for correcting all types of vision difficulties.
How about astigmatism?
Not a problem at all. We can correct astigmatism, farsightedness, nearsightedness, the whole spectrum.
All right. Now, is LASIK, has it gotten less expensive as it's become a little more common, or
well, LASIK actually, the technology has improved significantly from what it used to be. I would say that we are very much of a value cost center. I mean, our prices are much lower than all the other places around, so definitely it's very affordable.
And what kind of doctor are you?
I'm an ophthalmologist.
Yes, okay. So then you're qualified, because you don't want a chiropractor or somebody doing this.
I would not recommend that.
No.
Exactly.
Ear, nose, and throat doctor, not so much.
Does not work.
How long does LASIK take?
It's very quick. You can do both eyes in about 15 minutes.
Really?
Yes.
And is the person
You are awake while the procedure is going on. We just use eye drop anesthesia.
Okay.
You will feel a little bit of pressure.
And we're seeing that laser
The laser is actually going ahead, and we gently go ahead and create a flap of tissue. And as the flap is created, then we'll gently go ahead. It's extremely precise. It makes a flap about 100 microns or so. And then you go ahead and use the laser to correct the vision. The patient, I've had LASIK on my own eyes.
You have?
Exactly. And I did my wife's eyes, and that's how strongly I feel about the procedure.
Really?
Definitely.
And she let you?
She let me, yes, exactly.
You have a really good marriage.
It's working out well, exactly.
Now, are you able to drive home after this?
We recommend you come back with someone, but by the next day, you can go back to work. I mean, I was operating the next day after I'd had my procedure done.
Really?
Yes.
Really? Are there any follow-up treatments that you need?
You need to be seen the day after, about a week later, and just a few just to make sure everything is healing properly. But 99% of people, everything is just it's great to see patients the next day because they're so ecstatic, so excited about their newfound vision.
Yeah, no kidding. And how long does it last?
Lifetime, basically.
Really?
Yes. To me, I kind of view it kind of like braces. A lot of people come in, and now these days patients are coming in and getting the eyes corrected, and then it's a lifetime of good vision.
Very nice. And you're never too old to have it done?
No. No.
All right.
I mean, basically, there's all sorts of options out there.
I might be. Can you measure my corneas right now? Can you see anything in there?
Looks great.
All right, Dr. Shamik Bafna, right? Very nice to meet you.
Thank you very much.